Now with our special segment on vet tips and practices, here's Vet Call with Dr. E. Good morning, Dr. Easterwood. How are you doing today?
Good. Thank you for having me, Rebecca.
Well, I'm glad you're here, and we're trying out this new contraption we have here called Skype and doing a split screen interview. And this is our first one, so bear with us if we have a few mistakes. First of all, I've been wondering about cribbing and how can that affect a horse and what it is exactly. So can you start with explain what is cribbing?
Yeah, so it's a good question. It's one of probably the most well-known, what we call a vice in a horse, which is basically just a bad habit that the horse develops. And it's actually where they will place their upper incisors on something and kind of have a pulling back motion with their neck, and they'll physically, a lot of times, will suck air into their pharynx. A lot of people think that the horse is actually swallowing the air, but usually they just kind of suck it into their pharynx and kind of let it blow out. But they seem to get some sort of fixation on it and some sort of pleasure out of it to a certain degree. We think we don't know everything about it.
I'd read that maybe that can be caused from staying in the stall too much or certain foods that they eat. So what causes it?
Well, we really feel like it's mostly related to boredom, and sometimes we don't exactly know what causes it. We know that some young horses can develop it if they see a horse that's stable to cross from, so it can be a learned behavior as well. So sometimes if you got an older horse that's doing it, a younger horse will pick it up, and then once they start it, it's very difficult to get stopped.
Okay, and then what can horse owners do to kind of stop them from doing that? What devices do you have?
Yeah, again, it's difficult to get stopped either way you look at it, but usually there's a lot of different type of collars that provide some sort of physical deterrent, underneath their jaw or around the neck area. Most of the time I see most of my clients that have those, a lot of problems. I see that most of the time they just don't put them on tight enough, so a lot of those have to be placed on very snugly, and it's uncomfortable for the horse because it deters them from doing it. There's also some surgical approaches that have been done where we've actually gone in surgically to take out a piece of the one of the neck muscles that allows the horse to do that behavior. So that surgery, we found out it really didn't work great, so I don't recommend it unless you're having a major problem. But those are just some of the ways that you can try to prevent it once it gets started. And then obviously trying to get the horse out, turn the horse out, and give it a job. Give it some work to do, and try to keep boredom at a minimal.
And what about how it affects the horse's health? Because I'd also read about ulcers and colic associated with that.
Yeah, I'm not sure that cribbing can directly be associated with ulcers and colic, but most horses that are stressed, or most horses that crib, are going to be stressed or bored. And so, the two main things that we see with horses that are cribbing are, number one, enlargement of those neck muscles after years of that physical action of pulling back. You'll see their neck muscles enlarge, and then also it'll wear down their upper incisors where they're grabbing on to to whatever object that they're grabbing onto. But ulcers and colic, if the horse is ingesting any air, colic could definitely be a concern.
And then how does cribbing affect the value of the horse if you're going to try to sell your horse?
It would definitely decrease it. I mean, it's a problem for people. These horses pull a lot of boards down, and it's they teach other horses how to do it, so it's definitely not wanted. So although it's not a deal breaker all the time, it can definitely decrease the value on a pre-purchase exam or any deal.
Okay, and is there any way to prevent it from happening in the first place?
Yeah, I mean, the best way to do it is, like I said, if you've got another horse doing it, especially a younger horse that is watching the older horse, you want to try to maybe separate those two horses before the horse learns how to do it. And then also, as I said, getting the horse out, a lot of exercise, maybe giving it a job, a different routine every day just to occupy the horse's mind. Other things like things inside of the stall when the horse has been stalled for long periods of time, like I said, just to maybe try to occupy the horse so that he's not wanting to crib.
Okay. All right. Well, I appreciate you sharing your knowledge with us today. Thank you so
All right.
much.
You're welcome, and I hope the Skype deal was good.
Yeah, we'll check it out afterwards. And listeners, if you want to learn more about Dr. E, you can go to easterwoodequine.com or call 205-663-4000. This is Becca Salomon, the voice of Alabama Horse Talk Radio, saying thanks for listening to Vet Call with Dr. E, bringing you tips and practices from the equine veterinary world. Submit your questions to alabamahorsetalk@gmail.com and stay tuned to hear your questions answered on Alabama Horse Talk Radio.